Presentation is about national healthcare system and organization of the healthcare system, especially home healthcare service in Poland. A few words about organization of healthcare system in Poland. By the Polish constitution, it is guaranteed that every citizen has the right to receive health service. The structure is we have a national health fund. It's in Polish and it's called Narodowy Fundusz Zdrowia. It is the payer, it's government organization. It gives money to the healthcare providers, so the hospitals, the doctors and all the staff, and they are taking care of the patients. But the patient, the circle goes round because the patients in their taxes financing national health fund. Basis of the healthcare system in Poland is family doctor functioning in the structure known as the primary health care. In Polish it's podstawowa opieka zdrowotna, so it's POZ, and the family doctor is working together with the nurse and the midwife. A few words about home health service in Poland. So, as I told you with the previous slide, the basis is primary health care, POZ, family doctor, nurse, midwife, and also the therapist. But also we have to take a look at the home hospices, because this is a very important part of the home health service in Poland. Here we have also a doctor, a nurse, but also a physiotherapist and a psychologist. Also in the home health service in Poland structure we have a municipal social assistance center with health carer who helps all the people at home to taking care of them, and other organizations which are something like voluntary services with volunteers, but without medical training. Okay, I'm just saying it, but we will not focus on this one because they are without medical training. These are organizations like I think you know something like Caritas. You have Caritas almost in every country. So this is the example of this point. Main national trends about the first 2 points that I spoke with previous slide is at the primary healthcare. Okay, so in Poland we have 150,000 doctors who are taking practice. That includes more than 8,000 specialists in family medicine, and we have to notice that in Poland family medicine is one of the most popular. There are no other specialists in any specialist who would be more than family doctors. We have the family doctors is the most popular. Okay, so the number is average 5.6 primary care physician at 10,000 patients, but that includes only 2.1 doctor with family medicine specialization. The situation is kind of different if we talk about nurses, because we have more than 200,000 nurses, but only 23,000 of them are primary care nurses, and within that only 2,000 has a specialization in the family medicine. Very little nurses in Poland have specialization. I don't know why, but this is a big problem of our healthcare, not only home healthcare but all healthcare, that nurses are not upgrading the education. And because of that we have one of the lowest number of nurses per 1,000 patients in the EU. We've got only 5 nurses per 1,000 patients. The average for European Union is 8.6. And just to compare, in Germany almost 10 nurses for 1,000 patients, so only 5 in Poland. About home hospices, public and non-public, this is the organization. This is the most developed branch in Polish non-public healthcare system. The national bodies in charge of the home health service, that's of course the national government and the mainly Ministry of Health, who decides about the policy of health service in the whole country, and the local governments who are taking the advantage of the home health service at the local communities. The main national policy that talks about health and home healthcare is the National Health Program for the years 2007-2015. I'm not going to talk about the details, you can read it in the national report if you want. Training courses for professional health carers. We have a family doctor and a family nurse. Family doctor gets the specialization of the family medicine after minimum 4 years of taking courses, and the family nurse is after almost 1,000 hours, and it's nearly 2 years. At the other specialization, so I don't know, surgery, anesthesiology, all the different, just similar, all similar to family specialization, takes also about 4 to 5 years for a doctor and about 2 years for a nurse. The main problems I was trying to identify for you are underpaid staff that connects mainly to the nurses. When I was writing this national report, I did some research and I find out that in Poland only 70% of nurses are still working